Good morning, everyone. My name is Teresa Fisher. I am the director of Strawberry Manson's Chetwynd Bowling Health Center. It has been my extreme pleasure to direct and manage Strawberry Mansion Health Center throughout all of its recent updates and renovations. Today, we celebrate this ribbon cutting as our renovations are finally complete. Ambulatory Health Services is extremely thankful to all of those who have worked with us during our various phases of construction. Dr. Bedical or Cheryl, who's next? Kasima.
Thank you very much, Director. Thank you so much. And I would like to say, first of all, thank you so much, Department of Public Health, Commissioner Bedigo, Director Cheryl Kramer, and all of you who have been very much involved in making Strawberry Mansion Health Center, really, all these years. It's been a lot of work, and we really do appreciate. And I'll also like to thank the advisory committee here. Miss Mary is here today from the advisory committee of the Strawberry Mansion Health Center. We also so appreciative of the Department of Public Health. We even named this health center at some point to honor one of our doctors in public health, Dr. Chetwynd Bowling. So Strawberry Mansion Health Center is so thankful, and thank you so much for all of you coming. We feel very much fortunate to have had the city pay attention here and develop a health center for the citizens of Philadelphia. Thank you so much. With that, Dr. Bedigo, thanks.
So good morning, everyone, and thank you for being here. I'm particularly grateful to all the people who made this happen. Cheryl Kramer, who directs our city health centers, Kusima Waraka, who chairs the board for the city health centers, Doctors Malone, Dr. Khan, who are part of the medical staff and lead the medical staff here. Dr. Malone is the clinical director. Dr. Khan is one of our pediatric medical specialists. Teresa, Teresa, who directs the health center and makes everything happen here. We couldn't do this without them. I wanted to say just a word this morning about primary care and why primary care matters, and especially our safety net. We've seen in the last 2 years the difference between people who had access to primary care, even if they were uninsured, and were able to get access early on to COVID vaccines, were able to get tested and treated early on. We also see it every day. We see people in Philadelphia, even though we're a very poor city, we have high rates of diabetes, people die at lower rates from diabetes in Philadelphia because of access to primary care. It matters, and we want to make sure that every Philadelphian is connected to a primary care provider, even if they're uninsured, because that's what's going to make the difference every day in terms of chronic conditions and in future emergencies. Their ability to get the resources and the information from a trusted source is going to make a difference. So I'm very proud to be here at the Dr. Chet Bowling Health Center, otherwise known as Strawberry Mansion, to mark the completion of a huge amount of capital work and renovations. This health center saw more than 20,000 visits in this past year, even though we were in the middle of a pandemic. 87% of patients here are African American, 65% are under the federal poverty line. So this has been a $3 million investment in city capital funds and state funds. It includes repairing the HVAC system, which in this kind of heat, you can imagine, makes a huge difference. It's comfortable in there. The installation of a full-service dental suite for the first time, 2 operatories, sterilization facilities, a dental lab, and a panoramic x-ray unit. A new, larger pharmacy with its own waiting room. The installation of energy-efficient LED lights, both inside and outside the health center, funded through the Office of Sustainability. And that's part of our efforts to become a greener city. Renovations of the medical records room and the small conference room where patient education meetings are conducted. And renovations of the waiting room with new flooring, paint, and furniture that permits social distancing. And then renovations of the administrative area, so we're not tripping over boxes everywhere we go, and it's streamlined. You can get your work done. All of this gets to what I've really heard from many community members and from health department staff, which is that our facilities, no matter what neighborhood they're in, need to look welcoming, that people feel taken care of when they enter a welcoming environment. And that's what you'll see when you walk into this health center. So we are very proud of these investments. I'm very grateful to everybody who made this happen. And we're grateful for the community that it serves and the many partners who made this possible. Thank you very much.
Folks, have any questions about today's event? All right. Any other questions? I'm fine if there are none.
Will the three speakers still be here for a while?
Yes, we can set up individuals.
Is there a ribbon cutting?
We don't have a ribbon.
Okay.
Or big scissors. We do have a tour though. So what we can do is Matt can start to lead you guys through, and